All right. Hello, my lab squad. So today I am renaming you from my lab family to my lab squad. Let me just call it the 2025 swag. Now, um, I want to welcome all of you to this channel, and particularly to remind you that this channel is for both students in biological, medical, laboratory, biotechnology, forensic scientists. It is for all of them, students or even professionals, and it is also for everybody because we also talk about some health issues, some diseases, and I have even discussed skin infections. I have discussed things like boils, so infections that we get in our day to day. So all of us are invited. Okay, so today I just finished some lab work actually, and let me just remove these ones. And I remembered something that has been disturbing me for a while. Yeah, for a while, because I am in a research setup, and we have been doing some research within Thika locality in the hospitals and all that. And a very good friend of mine called Dr. Rachel Kimani, I'm going to put her here. She also has a documentary of her research at MKU. She recently graduated, and she has done a lot of work on hospitalized infections and their treatment and how it goes at Thika level 5. So I have been thinking about the staggering results that she has presented to us, and of course also from our literature, journals and all that, concerning antimicrobial resistance, AMR. And this is actually becoming a silent pandemic. So what is AMR? AMR stands for antimicrobial resistance, and this simply means that microorganisms are becoming resistant to medicines that we usually will treat the infections with. And we can have different resistance towards antibiotics, antivirals, antiparasitic medication and all that. But today I want to focus on misuse and overuse of antibiotics, medicines used to fight bacterial infections. Now, it's a big issue, and I actually remembered it today, unfortunately, because I have a common cold. I know you can tell that my voice is a bit hoarse, and culturally or societal wise, the time you get like a common cold, a flu, or you feel like your body is not okay, the first thing that we normally do is run to a pharmacy, and you're like, give me amoxicillin, give me Panadol, give me blah blah blah. I know you know what you normally ask for in a pharmacy, and that's the natural thing. So I remembered, well, I need to share this whole issue of how we are misusing and also overusing these antibiotics. Because, like, for example, a flu, a common cold, usually will start, then it will have like a peak point when you feel really bad, like I was feeling earlier this morning. You feel really sick, you feel tired, you feel like all your muscles are aching, and you're like, I need to take some medicine, and it's some azithromycin, I need Cipro, those ones. And usually it will peak at that point, and then all of a sudden then it's down and you're good, because your body is able to actually fight the infection. As I was reading, I saw this study by University of Oxford in 2019. They did a global study on antibacterial resistant infections, and they did like a heat map, which is what now I have displayed. And a heat map means they try to grade the different prevalence of these antibiotic resistant bacterial infections across the world. And you can see the colors that are towards light green, yellow, orange, red means high intensity of antibiotic resistant bacterial infections, and those that are towards green, dark green and purple, those ones have less percentages of antibacterial resistant infections. In Kenya, you can see we are around 30 to 40%, yeah, which is not a good thing. Now, in Canada, there was a study in 2019 as well that discovered that there were 5,400 deaths of people attributed to antibiotic resistance. That is like 15 deaths in a day. That is not a good thing when you consider it is antibiotic resistant. It's not an actual disease, but it is resistance to the medications being used on the patient. And they recorded that around that time, annually, they were spending $1.5 billion on treatment related to antibiotic resistance. Yeah. And essentially over time, I had mentioned in a video that I'm going to link here, where I was looking at skin infections, they have realized that there is a doubling of what you call MRSA, methicillin resistant Staphylococcus aureus, which is quite a stubborn bacterial isolate. Yeah, so it has doubled by now, and that is not a good thing. Now, you may probably be wondering why I have gone all the way to Canada. What about Kenya, where I am? There is only one problem in Kenya, and I will call the scientists to help out. We do not have enough data, and the data that has been present is site specific, like it has been done in a single center. For example, there was a study that was done at Nairobi in Karen Hospital, and this was done between 2012 and 2016, and they were trying to document the resistance of several isolates, and they found that we had 89% of resistant to enterobacteria isolates, those that affect the GI and all that. Then we had 57% of Staphylococcus aureus isolates, and we had about 50% of Pseudomonas isolates. Yeah, and hopefully we can actually get more data as we continue to do research, like this paper that was done by Dr. Rachel. Now, what is actually happening for us to get to these statistics? One is misuse of antibiotics. When do we misuse antibiotics? It is when we take them when we don't actually need them. Like, you feel you have some sickness, then you run to the pharmacy, get some antibiotics and go and take them. Whereas you really may not even need, because a common cold will just resolve on its own. Yeah. Another is connected to the same is when you treat flu with antibiotics, you are making a big mistake, because a common cold is a viral disease or infection. It is not a bacterial infection, which instead of being treated with an antibacterial, should be treated with an antiviral. So what are you doing? you are misusing because you are not treating the correct infection. Then we have overuse, and this we are a culprit. And I think this even generally most households in Kenya, at least for Kenya, you will not finish your antibiotics. Told 5 days, 7 days, you take them for 2-3 days and you're feeling, I think I'm better. So you decide, let me just keep them. Or you forget. Sometimes actually it's forgetting because you stopped feeling as bad as you were doing 3 days ago. Another problem is for those who have children, you share and you say, I bought this antibiotic, they seem to be having the same illness, so you give them. So what that means, each of them do not finish their course because that's not a complete dose. Yeah. Then so there's that sharing and not finishing your course, and among other times when we are overusing. So what happens when we do that? This bacteria that is in your body that has infected you will then get so used. If you are taking these antibiotics for long, you will get used. This person has been taking this for long, so they get used and they no longer are effective. Or when you don't finish your course, you give the bacteria an opportunity to change, to mutate, to become something different. When they become something different, it means that that original drug that you are using on them then cannot work on them now because they have developed new ways of survival. And remember, this is happening to the bacteria, not you. So this whole pandemic actually affects all of us, even if some of us are like not misusing and you're not overusing. Why? Because you're changing the bacteria. So once it has changed, their ecosystem changes. So it means that next time, whoever is infected, whether they were misusing, overusing or not, gets the new strain. So eventually, person A who is doing the right thing and person B who is doing the wrong thing, all of them will have antibacterial resistance. But for all of us. Then remember that this antibacterial resistance occurs at any age, occurs with every race. It does not discriminate, it is everybody. But the downside is, if common illnesses no longer respond to the medication that we give them, means that we will stay longer in hospital. Like hospitalization increases. Then if your patient, you or your patient remains in hospital for long, huge medical bills. And then if they really don't get well, which is the biggest issue, they will die. Yeah. And remember, we normally have classes. I will discuss this in another video. Classes of antibiotics and medicines, where we have the first line, the second line, the third line, depending on strength. And of course, even as you go higher, even the side effects become more. So if this first line cannot treat you, then you need to be careful. It means that there's a problem within your system, because it would mean we would require the second line. If the second line doesn't work, it means we require the third line. And we have research says that in over 35 years, we haven't made new antibiotics. So it means that we can get to a place where we don't have anything that can help you. So be careful. So what is it that I would want you and I to do? The first thing, when you feel sickly, avoid going to the pharmacy to tell them, I want this, I want this, I want this. Pharmacies are not bad, but you don't go to instruct them, oh, this is what works for me. No. Go to the pharmacy, go to the clinic, go to the hospital and tell them what you feel, when it started, and what they would recommend. In short, seek professional advice. Number 2, If you have gone to a health center and your doctor has given you a battery of medicines, you have 1, 2, 3, 4, it is good to ask what each of them is and where it's going to treat. Like, the relevance of the medication is key. Now, assuming you really need this medication, the investigations have said yes, you need them, please finish the dose. Put them somewhere where you can see, even if it is in your bag, in your purse, near the door, on the counter, near the TV. I mean, depending on where you frequently can see it, please put them there. Of course, keep them away from children. Then I again forgot the count of numbers. The next point, do not share, especially among children. Don't share medicines. Just for child 1, use their medicine. For child 2, use their medicine. Blah 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 blah. Yeah. Well, I hope that this concerns you, so that you can take necessary steps for your own good and for the good of me, yourself, your neighbor, your family, your children, and everybody that is around you, and for the general population. Yeah, so that was our discussion today. I hope this was helpful, and if it was, please like this video. If you haven't subscribed, subscribe, and then share it to somebody else who may actually need it. Bye bye for now.